Hello, welcome to Nursing with Professor B. My name is Bridget. I have a master's degree in nursing education. I'm also a family nurse practitioner. This is Bella, and she has a PhD in cuteness. So if you hear rustling and bustling, it's her in the background. Today, she does not want to take a nap yet. So today I will be answering a viewer's question about why I obtained a master's degree in nursing education prior to becoming a family nurse practitioner. Do I regret becoming a nurse practitioner? She has some excellent questions. So if you're interested in these questions and more, make sure you stay tuned. But first, make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell. All right, without further ado, let's get started. So this viewer wanted to remain anonymous, but she says, "Good evening, Professor B. My name is so-and-so. I enjoy learning from your videos. Thank you for sharing your knowledge. I really appreciate you, and I appreciate everyone that watches my videos. You have no idea. I had a question on going back to school to further my education. Why did you choose the education route first and not the FNP route first? I thought that you can teach graduate school as an FNP with your master's degree, which sounds like you don't need a master's degree in education to do that." So that's an excellent question, and she's right. And I often kind of kick myself in the butt for doing that as well. But the reason why I first went to school to obtain a master's degree in nursing education, Bella's back. She doesn't want to stand still, and she's under my chair. So the reason why I first went to school to obtain a master's degree in nursing education is because I never thought I wanted to be a nurse practitioner. I love education. I mean, even when I was in nursing school, I was a peer tutor. Even before that, when I was doing prereqs, I was a tutor for anatomy and physiology. So I have always loved teaching and education, and that's why I love making YouTube videos, because again, my passion is teaching. It says, "Why did you choose the education route first and not the FNP route?" So I was sure that I was just going to become a nurse educator, and that was that, and I didn't want to be an FNP. So if you are on the fence and you're not sure if one day you want to teach or if you want to be a nurse practitioner, then I would encourage probably nurse practitioner over education. I may get some pushback from this from educators, but to be perfectly frank with you, I don't feel like the amount of money I spent on my master's degree to obtain a degree in nursing education, I honestly, I don't think it made me a better educator, which is sad to say. Whereas the FNP program, I feel like that was worth the money. I did learn a lot in that program. I will call you, because it's hard for me not to say your name, so I will just call you Sue. So Sue, my suggestion to you is, if you're on the fence and you're not sure if you want to be a nurse educator or a family nurse practitioner, then I would recommend that you probably just go the FNP route, and then you have the option to teach if you so choose to. If you're absolutely sure you never want to be a nurse practitioner, which is what I thought, and here I am as a nurse practitioner, but if you are adamant you just want to be an educator, then sure, go to school for education. And then Sue says, "Both teaching and providing preventative care are one of my passions. Can you please provide me with some insight on both career paths based on your experience?" So one of the reasons why I decided to just do nurse practitioner immediately when I was done with educator is because I was a little bit discouraged with the pay that educators get. And life is not all about the money, but I just don't think it's fair that for a master's degree, both degrees are master's degree, and one pays more than the other. So money was one of the reasons why I chose to get an FNP degree, just in case teaching didn't pan out, etc. And it's okay, like in nursing, I think because it's a predominantly female dominant profession, we don't like to say things about, "Oh, I want to do this for the money." It's okay to want to have money, and there's no shame when a man says, "I want to be wealthy, I want to be prosperous." But as women, we kind of tiptoe around that, and we want to follow our passion and do this and that. And passion is important, but passion doesn't pay the bills always, right? She's saying that she's recently spoke to 2 graduate FNP students, and They say that they regret going to family nurse practitioner school because they made more as a bedside nurse. It's overwhelming. You barely get a lunch and bathroom break, and there's increased liability with no increase in pay from bedside nursing. So that's, and again, thank you for this. I'm not sure where your colleagues work, because I definitely make more as a family nurse practitioner than I did in bedside. So I don't know if they're working in New York. Even with my boyfriend working night shifts, I still make more money than him as an FNP. My experience is that you have to advocate for yourself. Don't just get a job out of desperation. You want to pick a job where the pay is appropriate. If all NPs fresh out of school start accepting jobs that are paying $50,000, well, that's going to drive down the salary for nurse practitioners. We all should be demanding a certain pay scale, a certain pay rate. And that goes back to us being a predominantly female-dominated profession. We tend to be martyrs. Men have no problem with saying, no, I have a male nurse practitioner friend that recently got a job in telemedicine, and they countered one offer, and he countered back like $25,000 more. Most women would never dream of countering with $25,000 more because we're afraid to rock the boat. We want to be nice, and we're too polite sometimes. Like, we need to advocate for ourselves, know our worth, and not take less than our worth. So I don't understand how some NPs are making less money or the same money as a bedside nurse. And if they are, then why did you accept that position to begin with? I understand you have to get experience, but don't just accept anything. Have standards is basically what I'm saying. I'm not trying to sound mean at all, but we need to get standards in the profession so that physicians or whoever's hiring is not just walking all over us. It's overwhelming. It can be overwhelming at times, but bedside was also overwhelming for me personally. With bedside, because I was in school at the time, I never worked like PCU or a higher acuity floor. Maybe it would have been less overwhelming, but working med tele with 5 or 6 patients, some that at times were totals, that was more overwhelming to me than being a nurse practitioner. My frustration with being a nurse practitioner where I'm currently working is the fact that they keep increasing our workload with no pay. And then Sue said that you barely get a lunch and bathroom break. And then I go back to bedside nursing. I'm not sure where your friends are working, but I have a scheduled hour break. And it goes back to setting standards for yourself. So even, I try my best, and I stress myself out more than other providers, but I try my best to see patients on time, not make them wait forever. I work at similar to like urgent care where people come in and then I see them. It's not an urgent care, but I don't want to disclose the location of where I work. But it works in that premise. It's not a primary care office. So I try to see them as soon as I can, right? But life happens. Currently, we're overworked where I'm at. Is it as bad as bedside? I don't think so. And again, I'm making more than bedside, a lot more than bedside. That being said, if I'm getting my hour, I have to take an hour lunch break. As a bedside nurse, I barely ever was able to take my full 30 relaxed, because in bedside, you have the doctor calling your SpectraLink sometimes. So you got to hand off your phone, right? But you're leaving 5 or 6 patients. You have to give them to another nurse that also has 5 or 6 patients. So you feel guilty because this person has that many patients, and you're like, well, what if they need something? As a bedside nurse, I never got my full 30-minute break during the 12-hour shift. As a family nurse practitioner, I get my hour break. When lunchtime hits, if there's patients waiting, I'm sorry, this is what it is. I'll be back at this time. I'll see you then, right? I lock up and I go to lunch and I take my full hour because they're taking out of my paycheck or anything. And because I don't have patients in a bed that need to go to the bathroom or need their PRNs, I get my bathroom break. And in between patients, I have interstitial cystitis. I have to go to the bathroom all the time. So in between patients, if I have to go to the bathroom, I tell them, excuse me, I'll hold on I'll be right back. I'm just going to go to the bathroom real quick, right? And usually they're perfectly okay with it. It just takes a few minutes to go to the restroom, right? So again, if they barely get a lunch and bathroom break, I'm wondering, where are they working? Now, maybe I'm confused, and maybe you're saying that you barely get a lunch and bathroom break, so I'm not sure. So there is increased liability as being a nurse practitioner, but again, if you follow guidelines and evidence-based practice, you decrease your liability. And this has made me cautious on whether I should pursue an advanced degree as an FNP. Perfectly reasonable. All your questions are perfectly reasonable. At the end of the day, Sue, it comes down, know thyself, right? I knew I couldn't stay in bedside forever. I knew myself. I couldn't, right? Even now, knowing myself, my personality best fits the personality of an educator. That's my personality. I love teaching. I love education. Education doesn't pay unless you work for a private institution. And even so, and if you work for a private institution, maybe they'll offer you around $75K a year. If you work for like a public school, sometimes it's like $50 or $60K a year, right? So life is not all about money, but you will make more money as a nurse practitioner. I would be willing to, some days I question my life, and I would be willing to take a pay cut in order to be an educator, but I'm not sure yet because I have several things to consider. Yes, people have talked about NP saturation. That's a very real thing. There's a lot of subspecialties within. So Sue, another consideration is, are you sure you want to be a family nurse practitioner? Do you want to do psychiatric? I saw a video recently about a gentleman that is a nurse practitioner complaining about all the specialties that there are within the graduate degree level, and the fact that when PAs go to school, it's just one program, 2 years, and they get a standardized rotation in a standardized area, and then they're done and they don't have to go back to school. So he did make up some good points. But before you choose FNP, do you want to work in a primary care setting? Do you want to work in a hospital? Do you want to do emergency nurse practitioner? Do you want to do psych nurse practitioner? Do you want to do CRNA? Like, make sure you weigh all your options. And then at the end of the day, advocate for yourself. Don't take pay that is less than what you're worth. Getting that first job does take time, and hopefully you know someone in the field, or you could always volunteer as a nurse practitioner at a low-cost clinic, network while you're in school, ask around. But I was able to I hear people say, oh, this person took this many months or years to get a job as a nurse practitioner. I landed my first NP job, I think like 2 to 3 months out, and then a position opened at the spot where I really wanted to work. So I quit that first job 3 months in and got the job where I'm at now. I've been here for a year. So the jobs are out there. The opportunities are out there. It depends truly on what you want to do and what's going to make you happy at the end of the day. The thing about educator and why I don't always jump into that full force is because I love the teaching aspect, and I love creating the courses and helping students. But then there's a lot of other duties that go into education, like into teaching, that I'm not sure if I want to jump on board with those duties. The university where I would like to teach, they currently have a hiring freeze anyway. They had offered me that position 3 times. I turned it down, so I may have burned a bridge there. I still teach there as adjunct. So I don't know. The other advantage to FNP is that after 3,000 hours here in the state of Florida, in other states it's different, you can practice independently. So that's another thing. There's a lot of opportunity in FNP. You can do telemedicine. You can work for specialists. I have a friend that works in urology. She loves it. I have a friend that works for rheumatology. She loves it. So as an FNP, you could always choose specialties. I have another friend that works in women's health. She loves it. So specialty is nice if you are a person that likes routine, because in specialty, you see the same thing every time. So you really specialize. That's why it's called specialty. You specialize, you know it backwards and forwards, and you can do a visit very, very quickly. And when you go for a job interview, make sure you're interviewing them too. It's like, don't just be so desperate. It's almost like dating. When you go to a job interview, you're screening that physician. You don't just accept a date with anybody and decide to start going steady with just any old Joe Schmo off the street. So screen the physicians. Are they good physicians? What's the ratings online? All those things. Think about it. Is this someone that you want to work with day in and day out? It's better for you to be picky and to take longer to get a job than for you to start a relationship. I'm going to go with this analogy, than for you to start with a relationship with someone who's going to make you miserable and be in a miserable relationship for, however many years you decide to stay. And even in my real life, I was very picky dating. I had standards. I would ask questions right away. Like, I don't want children. Do you want kids? Yes. Okay, this isn't going to work. Because what's the point of dating someone if you know it's not going to go anywhere? And now, I'm really appreciative of my boyfriend, and he's phenomenal to me. He's really good to me. So moral of the story is don't settle. Anyways, thank you so much for writing. I love answering your questions. I think that you had some excellent questions. If you want your questions answered by me, then email nursingwithprofessorb@gmail.com. At the end of the day, education is very rewarding, but you need a lot of patience. If you love teaching, go that route. I mean, there's FNPs that tell me they could never teach. They're like, I don't know how you do it. I don't have the patience. So it depends on your personality type. Like, what are you more? I'm more introverted. So I'd rather be in a room by myself talking to a screen than be out there with a bunch of people. Like, seeing patients for me all day, talking to people is exhausting. When I'm teaching, it's different because I don't know, it's like putting on a show almost. But when you're with patients day in, day out, it can be exhausting for an introvert. So what's your personality type? Anyways, I hope this answers your questions. And everyone else, thank you so much for watching. Make sure you hit the like button, make sure you subscribe, and make sure you turn on the notification bell. All right, until next time.